Can we stand for the invocation? Councilor Warner, would you like to lead us?
Yes, ma'am. Dear Heavenly Father, we thank you for this day, Lord. We thank you for this time of fellowship, Lord. We ask that you fill our hearts and our minds with your wisdom, Lord, and give us the patience and the guidance that we need to help guide the Cherokee Nation's business, and help us to remember that it's your business that we do during this great day. In Jesus' name we pray. Amen.
Ani.
Mike Dobbins.
Here.
Bill England.
Honey.
Keith Austin.
Here.
Harley Bezer.
Here.
Joe Byrne.
Honey.
Sean Crittenden.
Here.
Wanda Hatfield. Rex Jordan.
Here.
Dick Lay.
Honey.
Mike Shambaugh.
Here.
Theo Smith.
Here.
Denise Taylor. Here. Victoria Vesquez. David Walkingston.
Honey.
Brian Warner.
Ani.
Kaden Dudley.
Honey.
Jeff.
Has everybody had an opportunity to read the minutes? Motion made to approve. Any second?
Second.
And seconded. All those in favor say aye. Aye. Okay, we're up for reports. The Claremore Service Unit. And George is with us today. Good to see you, George.
Nice to be back after a brief little shutdown we had. I think you have my report in your packet. The last couple of months have been, had no travel, no training, no anything outside of just the main services and primary care going on at the hospital due to the shutdown. It was, so if there's any questions I can answer about the last couple of months, I'll be glad to.
George, did everything seem to function pretty much the same during the shutdown?
It did. We stayed open. We didn't. We had no slowdown on services. We didn't cut any services. I was able to get my folks paid, and we made it through. We had a lot of offers of help from folks, and you know, I thank everybody for that, and so we made it through okay. Thank you.
That's wonderful news. Do we have any questions? Any questions for Mr. Valerie?
How did you handle the flu season? Did you come out okay, much better than last year?
We've only had a couple cases that I'm aware of, so we're doing a whole lot better than we did last year.
Seemed like we had more of a congestion or sinus problems here versus the flu.
We have a ton of that.
Yes. Okay. Well, you're doing a good job, Ms. Valier.
Doing a great job. We appreciate it. Anybody have any questions for Mr. Valerie? We appreciate you
Thank you.
coming. Thank you. Have a safe trip back. Okay, Dr. Jones. OCO.
Good afternoon. Thanks for having me. I guess we'll start out and I'll call some attention to some of the things on our report that you should have in your packets. You'll notice on the first page we got recognition in our diabetic program as having an award that only 8 others have received in all of Oklahoma. So we wanted to recognize our diabetic program as being one of the best, of course. And everybody knows we work very hard with them. We have a big grant that's that we work hard to, and it's integrated in all of our clinics and all of our hospitals. So moving through the report, referral rate, that's something everybody asks about, 97.2% last month on referrals that were approved. If you look over at the ambulatory care, looks like everything's gone up a little bit from last year of this month. And if you look over to services delivered by the quarter on the RVU scale, you'll notice that J had a very big increase. We have a little arrow there pointed out to it, where it went from almost 2,000 RVUs up from the others, where the others had a little bit of a decline through the holidays, where a lot of providers were off work and taking vacations. But J had a significant increase. And when I talked to the medical director there to have her, kind of explain to me why, it's first time Jay's been fully staffed since I've been here in 2012 with providers, so that was one thing. She's implemented a few things there with same-day scheduling, requiring all of the providers to increase that, as well as having them look over their contract health referrals before they go out and going through those and seeing if there's anything they can do in-house and trying to maximize that. Also, of course, with the opioid laws changing, there's been an increase in visits with keeping up with our pain management patients. So she attributed all those things to that increase. So she's doing a great job, and want to recognize Dr. McCauley for the work she's doing there to increase the efficiency at that clinic. The only other thing that I can want to point out is I know it's on your agenda to talk about the naming of the outpatient health center. We had to make a administrative decision because of the requirements that we're going to have in order to get all of our certifications and our licenses done prior to that July 1st timeline. So we've used a generic name that we've selected as Cherokee Nation Outpatient Health Center at Tahlequah to do that application process. According to what our information from the AG's office, we can allocate a name temporarily for up to a year just to get through the process. Once we get through all those processes, a change would be fine. But we ask that, we leave it that way to get through all the certifications and not muddy the waters with all these license and certifications that we're having to do. Each one of these certifications are dependent on other ones to get us open so we can bill, so we can get our providers enrolled, so we can get our pharmacy certified, so we can get all of our radiology equipment certified and licensed. All that stuff has to be done prior to us seeing our patients there. And we're all shooting for that July 1st for part of the building. So some of those timelines are cutting it really close at this point, so a decision had to be made. So I don't know if that helps or hurts with your discussion, but I wanted to let you know that in advance because we had to make those decisions quickly. For example, Medicare sometimes takes up to 6 months to get our license. We're hoping we'll do that a lot faster, and we're shooting for more of the lower end of that at 4 months. So, but we can't enroll any providers till we have those numbers, and those providers are working in a different facility, so they have to be enrolled in that facility. So, with that, I'll open it up for questions. Oh, and I sent out all the answers for the questions from the last committee meeting, so if there's any questions that you have on any of that, I'd be willing to answer those questions. Counselor Lay, I checked into the transportation issues, talked to each one of the clinic administrators. The only transportation issues that we could find had to do with the community transportation. It wasn't due with our specific transportation that we run. So that's the only ones that we could find that we had complaints on, and it had to do with the CATS or the KBOS that runs out of the Veneta area, where they've left patients at the Veneta clinic and not ever came back and picked them up. So we picked them up and taken them where they needed to go. So those were the only issues that we were aware of. Okay. Are there any other?
Counselor Shambaugh.
Yeah.
Dr. Jones, I'd just like to say thank you for returning my call here a while back. And I've had some constituents address concerns about used needles, their diabetic needles. Some people take 4, 5, 6 shots a day, and those things add up really quick. You sent me some information on it. I've since relayed it to them, and I'm actually going to have to go talk to the trash collection where they take that stuff, because they didn't want to take any of that stuff. But the Diabetes Association says to do it this way, and that's what I've advised them to do. So I'm going to go talk to them and send them that link at least. But that's kind of a big thing. They just don't have any place to put their needles. I mean, and people don't want to take dirty needles, and it is a problem. And you talked about turning in old drugs too, and hopefully something can be worked up in the future where, like you said, maybe those two can be incorporated, and we might be able to figure out a way to have a place for them to take that. Because the lady I talked to, she's 6 times a day. So, and that really comes out to a lot of needles after a while. But I appreciate you returning my call and addressing that.
And I've talked with our leadership to talk about some possible possible solutions for that, and so we're going to brainstorm on it and see if there's a way we can offer something at the clinics to help with that, because I know that that is an issue, as well as getting rid of prescription medications when you're through with the prescription and trying to account for those so they're not staying in the home.
Well, the only other thing I had, it'll wait for discussion. I had a comment to make on the discussion part, but I can wait till then, since you're on these questions.
You know, I have a question about this. Is it possible that we could have some type of a cardboard container that they could perhaps return when they come to get the refills of the medication, and then let our medical clinics destroy them on their behalf?
Yeah, and that's what I'm saying. We're looking at some possible solutions. What we don't want is someone to come in and hand them to the
Exactly.
clerk behind the registration area.
Exactly.
So we've got to have a way to hand those off, that's safe for everybody involved. So
No,
we've
ideally a
asked
plastic
everybody
container.
to look at it and think about some options that we could come up with.
Okay, thank you so much.
Sure.
May I
Yes,
add one thing?
sure.
And at the PD, we do have like a mailbox where people come in and dispose of all their old meds, and the OB&DD comes by every so often, or I'll call them when it starts getting full, and they come by and pick it up. I don't know if we have anything like that with the OB&DD or anything like that, especially if it's any controlled substances.
Yeah, I don't think we have anything formal right now, but like I said, we're looking at some options for the public. We have stuff obviously for ourselves to work behind the scenes to get rid of sharps and things like that, but we don't have anything for the public to bring them in and get rid of them right
Well,
now.
even like an old mailbox type thing, where they can just come and open it up and put them in there. It's pretty convenient for people, and once they get to know what's in there, I think they'd use it a lot.
I agree.
Thanks, sir.
Yeah.
Had a comment on that, something the Marshal Service we talked about. There's some jurisdictional issues there because Oklahoma group doesn't have jurisdiction on trust land, so they can't and won't come on to trust property to pick up controlled substances. So there's been some discussion with this, I know at the Marshal Service, with some various folks too. So it's something that got a little added hoop to jump through to be able to offer it at some of our facilities.
Okay, thank you.
Anyone else have any quick? Yes, Counselor Crittenden.
Yeah, Doctor, I first want to tell you, I really like when you get questions, how you send them to us, what you found. I really appreciate that.
Sure.
And I had a constituent visit with last night. Now, the flu hit us hard down there in Adair County, and I think it drifted up to Hastings.
Yeah.
But this constituent was talking about, of course, the wait time. But her question, and it was a good one, do we have any sort of emergency protocol for this flu season that comes around every year?
As in staffing or?
Yes, just any sort of protocol for that?
Well, we don't have any additional staff to bring on.
Right,
But they do have, measures in place to, obviously a walk-in clinic gets slammed whenever we have the flu season come on. And I think the day that you had reached out to me and about
Right.
a patient that was waiting in North
Yeah. Then I found out there were 70-something.
Yeah, 78
people
patients that were walk-ins that particular day, and we had 2 providers out with the flu that day. So, so some of those things, you can't anticipate, but they try to do the best to work through them, and
course,
you
I'm
just don't know what
Right.
that time frame's going to be when it's going to
Gotcha.
hit. So,
Her question was a good one. If, like at Hastings especially, where there's some shift work, and of course, I teach school, and I'm not in the medical business, but it does look like in an emergency situation that just everybody would know, hey, we may need you to come in if it's your day off or during this season, because it really hit us hard down there. And she was at Hastings, so I'm assuming, I don't know the numbers on that, but she had a big number. But and also, I know we got good staff down there. I know some of them that's maintenance and custodians and stuff, but she noticed some pretty good spills that the kids were playing in, tracking the flu back and forth. And
this is at Stillwell?
no, this was at Hastings.
Hastings.
Here, yeah. And especially the flu season, we might make some passes through there. She said she was there 6 hours and didn't notice any cleaning up or any Lysol
And-
getting sprayed. But like I said, that's not a stab at the staff. But I think that would be a pretty good idea to kind of keep on top of that, especially when that old flu's going around.
Check into it. Was that in the urgent care area?
Yes, just
Probably.
the emergency. And also, I had someone call me, and now are you over the elder care, or is that human services?
Elder care, you're talking about PACE?
Right.
No, PACE has an affiliation, but they're not under health. I mean, we don't direct them, we're not.
So that'll be
have
more-
oversight over them. They
more
have
human
their own
services.
board, and I'm not sure how they're affiliated with Cherokee Nation. That's that affiliation. I'm not real up on that because we don't oversee them. They're not anybody that works for PACE that's underneath my supervision. So the three entities that we have affiliations with, that I'm not really sure how that works, and maybe that's a question for another group. But is the hospice, home health, and PACE.
Okay, so any questions about who may have been appointed to certain positions, or any job openings, and who may have interviewed them, who may have, sorted through, who may or may not have applied, wouldn't go through.
Doesn't go through me.
Okay.
I think PACE particularly has its own board, but I'm not sure how that works.
Todd, do you have an answer for this?
Yes, I was going to say, in relation to that question, PACE does have its own board that oversees that organization. It is affiliated, as Dr. Jones stated, but it's not organized underneath health or human services. They have their own board. And I believe Ms. Thelma Pittman, who attended a council meeting a couple of months ago with Deb Proctor, I believe she is fielding a lot of those questions from a staff perspective at this point, if you had any questions.
Now are they Cherokee Nation employees, the lady you mentioned there?
Thelma?
Big time.
I'm going to let Chrissy answer that.
So it depends, for the purposes of employee protection, that if they've been here for 1 year under the Constitution, they can only be terminated for cause. They are currently Cherokee Nation employees. There's a long standing appeal where there was a employee who was terminated there, and she said that she should have been covered under the employee protection statutes of the Cherokee Nation. That case is actually ongoing, but for those purposes, they are considered for constitutional purposes, they're considered employees. I believe they benefit share with us for like insurance and 401k and some of that, but they have their own HR department, and they have their own board of directors. They are a statutorily created entity, for lack of a better term, of the Cherokee Nation. Their board members are appointed. I think it's one of those, some by chief and some by council, but I don't know for sure. I think you all vote on at least some of their board members. So it's a hard question depending on what we're talking about, whether or not they fall under us.
Health admin don't appoint the board members?
No.
So
And they were created by law passed by the council.
So let me ask you this. So they're asking me, but really, you, chief, anybody that may have a question or a problem, really, hands are tied as far as since they have their own board?
So their board, and our office represents them in legal matters. They have issues, come up with contracts dispute and that type of thing, and we represent them. But they have a 5-member board who it makes decisions regarding their budget, their some employment issues. I don't think those probably all go up to the board. And then they're governed by, because they bill Medicare, much of the rules and regulations that apply to them are under Medicare.
I got a pretty good letter, and I'll just come out with what it was. Is the position that Miss Proctor has left for was filled by someone, and these folks were curious if there were other applicants who actually picked or appointed, or what process that was. They had concerns about that, so it sounds like I can't go to really anyone in the Cherokee Nation to to get those concerns addressed?
So their board, again, would be, but I'm not sure that, as a tribal counselor, you may have access to the information, but we don't typically tell people who applied for a position, right? Like, that's a confidential, when there's a position open, whether it's in Cherokee Nation or PACE or one of the entities, we don't list the people who applied for that, or the selection. You know, when I interview someone, I have a little sheet and I have to ask them a bunch of questions and score them, and that's not public information. Whether or not you, as a counselor, have access to that, I'm not sure. But it was,
Yes, and I wouldn't, you know, I wouldn't want to stick my nose too many places. I'm not afraid to, but just, my thing is just to get a pretty good answer to take back to the person that was concerned.
and they have a board that has, I believe, monthly meetings. They're subject to open meetings, open records, just like the rest of Cherokee Nation is. But they do have their own HR director, their own policies and procedures. We coordinate with them on some things, but they are, for hiring purposes, they're a separate entity.
Separate entity that even, like I said, Todd, you, Bill, John, they couldn't go in that meeting and start telling people what to do, right?
Well, we give them legal advice because we represent them, but
Legal
we can't,
advice.
but any decision that they make, they have a 5-member board, they have to have a 3-member majority to make a decision.
Like if you had a favorite you wanted hired, you couldn't go?
I never do that.
Okay, I mean, I'm just saying,
No, it would, the board.
Who could stick their nose in?
No, the board. The 5-member board would
Just-
make
just the board.
a determination. On top-level positions, I assume, I mean, that's a big agency, so they have custodial staff and some of that thing, and I assume that their HR and their executive director make some of those hiring decisions without going through the board.
Separate entity though?
Right.
Okay.
I don't think every position they hire probably has to have board approval, but I don't know that.
And they
Chrissy,
don't
do you
have-
know who
they don't have
replaced
to
Ms.
check with
Proctor?
us.
No one at this point.
And they don't have to check with Cherokee Nation on those decisions that they make?
Just like any other of our election commission, tax commission, gaming commission, those board members, once they're appointed to that organization, they are the decision-making authority for that entity, organization. In this case, I believe they're technically a nonprofit,
And no input?
other than when they come back up for approval, you get to vote on them.
Well, thank you. Thank you, Liz. Appreciate it.
Connie, excuse me, I was told over the weekend that it was Connie Davis. Can you yes or no on that? Is she acting director?
No,
No.
no, there's not been a final decision. Well, I don't know if there's been a decision made, there's not a contract.
Well, who's in charge if we wanted to approach Elder Care to see if they'd like to come and talk with us?
I do not, I assume maybe Thelma Pittman is the acting, but I do not know that.
I thought
Deb
Thelma
resigned.
Pittman was a board member.
No,
No.
She is a nurse that works there.
she's a employee there.
Okay, thank you. That'll give us direction on who to approach then for our questions. Thank you. Counselor Crittenden, I'm sorry, was that all your question?
That's it. Thank you.
Yes, Counselor Walkingstick.
Hey, Chrissy, we pay 49% of NEO Health, and if this employee that the chairman mentioned, if they do get the job and they're being contracted through the PACE program and NEO Health, will that be a conflict of interest?
So you're talking not NEO, this is Northeastern Health Systems. We have a 51%,
Okay, so we're 51%, excuse me.
not of them, of Cherokee Health Partners, which is the LLC.
So is there a conflict there with the NEO Health 51% and then the PACE program? If this employee does accept the position and there's a contract that gets rendered, will there be a conflict there?
Not that I know of. There's not.
If you're an employee, you cannot have an ownership interest in a business that contracts with Cherokee Nation. You can be an employee of a business. Like, I can have 2 jobs. I can go work for some business that has a contract with Cherokee Nation, but I can't have an ownership interest in it. So I don't know the details, but we would definitely look into that if,
What's the holdup on the contract?
what's the holdup? I don't know. I just know it's not done.
Who's drafting that? Is our legal team drafting that, or is it the board that's drafting the contract?
We review contracts with them sometimes. It's my understanding that the board has not met, that the board has not voted on approval for that. So I don't know where exactly the process is.
So we're not drafting the contract, our Attorney General's office is not drafting?
No, we very well may be, but
Okay.
we can't enter a contract. We draft contracts and review contracts for them often. Again, I said we do legal representation for them. But their board would have to vote to hire an executive director.
That's all the questions I have, Chairman.
Counselor Lay?
Thank you, Madam Chairman, and this may be something that we need to do with the council, I guess, I don't know. But there are several health entities that work on behalf of the Cherokee Nation. And so, do we know how many there are? I mean, there's home health, there's PACE, there's elder care, so are all of those employees of the Cherokee Nation like you're talking about just now, or not?
So PACE and elder care are the same thing. There's comprehensive care agency, the adult there's kind of 3 levels to that all falls under. So PACE, elder care is all the same thing. Home health and hospice, it's the same thing in that for certain
Dr. Smith back.
for constitutional purposes, they are Cherokee Nation employees, but they don't necessarily fall under Cherokee Nation regular full-time employee health and human resources policies and that type of thing. I also believe, and Steve, you may know more, that hospice and home health have some independent HR functions. So like if you apply for a job for them, they have their own process. They don't go through our HR, and I believe, again, it's because they are LLCs or they're some type of business entity that for billing reasons and regulatory reasons have to have some separation of Cherokee Nation. It can't just be Cherokee Nation regular full-time employees that do it. But we've given legal advice to hospice and home health before as well, but they don't fall under the same employment requirements that I do. They're not considered regular or full-time Cherokee Nation employees for policy purposes.
In health, we don't have oversight over them. I don't have oversight over them.
And so, Dr. Jones, if somebody needs hospice help, do y'all through health advise folks that that's available?
We refer into them. We give the families obviously an option. You know, I can tell you from my experience that, you know, I had options out there, but I chose to use Cherokee Hospice when that time came. So.
And what your area would those hospice help come from? Calico area only, or?
I'm not sure how big they're, like I said, we don't have oversight. I don't have any oversight over them, so I don't know a lot about their entity specifically, but.
So they have a regulatory area, and I think it's a 50-mile radius in which they can cover, and that's because when you're on hospice, you need someone to be there. You don't want them driving 3 hours. Also, the reason I think hospice, home health, and PACE are all somewhat separated from us, all of those 3 have to take people regardless of Indian status. You don't have to be native to receive services from one of those 3 because they bill Medicare, and they can't provide services only to natives like our actual Cherokee Nation health facilities are. So that's one of the other reasons that they have to have some separation, because unless in very specific incidences like you're pregnant or you're a minor child, you can't get services through Cherokee Nation Health if you're not native. But those 3 entities, I know for sure that they cannot deny services to non-native people.
So if I'm from Copan, Oklahoma, and I need hospice, I'll have to get Tahlequah to make that provision through hospice care?
No, you would contact someone in that area. There are both for and nonprofit hospices in most counties.
There'll
that
be a
serve most
hospice in
counties.
that area that's affiliated with that area.
Well, yes and no. But sometimes it works, sometimes it doesn't. That's why I'm wondering how people from outside that 50-mile radius could access
I think what
Is it?
yeah, what you're trying to get at, the hospice itself is not operated by Cherokee Nation. It's not a program where beneficiary can go in and be completely subsidized for like we do with our own internal. They're located geographically by regulatory geographic locations. It just so happens that we have this one formed in our geographical location within that 50-mile radius, is what it sounds like.
I think it's 50.
Yeah,
I can't-
or
I
whatever
worked,
the
I
mile
worked for a
radius
hospice
is.
for several years before I decided to be a lawyer.
I have a question. I want to ask the two of you, would it be your opinion that perhaps council should ask elder care, home health, hospice to report quarterly, perhaps like public health does? Give us a report, combine the organizations there, not public with public health, but with the hospice, home health, and then elder care, to where at least we know what's going on, since it sounds like they are our employees, and find out what's happening, even though they may have their own boards. What is your opinion?
I think we can definitely look into that for sure and see what the legal ramifications are of that and stuff like that, so,
And elder care was here, I think.
We had,
I think at
yes.
the last meeting.
yeah, last
Yes,
month.
they were. Yes, we had some questions, and Ms. Proctor answered them. Do you think that, I'd like to have input from the board, the tribal council here. What is the opinion of the council?
Yes, if it's a service to the people.
It is a
all
service to our
All
people.
we know, the better. The more we know, the better.
The more we know, the better. You agree? Dobbins, you agree? Buell? Victoria? Good. Okay. We could make this in the form of a motion that we have them report quarterly?
Second.
Okay, second. All those in favor?
Aye.
All opposed, same sign? Okay, we're going to report.
I have one more question.
Sure.
Hey, Tracy, so the employees that's under PACE, are they, you said their benefits and the 401K and the employment personnel all falls under Cherokee Nation?
So I believe they benefit share with us, which, so does the Housing Authority, which isn't us at all, but we have, because of the number of employees we have, we can allow other organizations to participate in our healthcare and our 401K. And I think PACE does that, although I'm not sure.
Okay.
They then have their own set of HR policies and procedures. Because of this court,
Do they have their own HR department? So they hire and fire, and the Cherokee Nation doesn't do anything with that?
because of this court case that said,
Contracted under Cherokee Nation.
they're not contracted, but because of this court case that says their employees are entitled to constitutional employee protection, before they fire someone, they work with our HR office and our AG office to review that termination packet before they administer it. The way that we do it for any other Cherokee Nation employee. Did they violate the policy that they're alleged to violate? Is the proof there? And that's a standard across the nation. So because of this court case, they
Which court case are you referring to?
the case is named Younger.
Okay.
And it was an employee that was fired from PACE. She sued and said, hey, I'm a Cherokee Nation employee. I can only be fired for cause, and I have to have pre-termination due process.
Okay.
And the court said, for the purposes of constitutional protections. Then there was another question, was whether or not she fell under the EAB process and could go to them. But for the purpose of, you have to have for cause and you have to have pre-termination due process if you've been here for a year, the court said yes, for that constitutional purpose, PACE employees are Cherokee Nation employees. So our office, like we do for any other termination, to ensure that the rules are being followed and there's sufficient proof there, we review those prior to administration. But it's still their policies and their HR files and everything else that leads up to that. So we're looking at it from a employee protection, constitutional protection
So
standpoint.
the future employment of the director has to fall under the Cherokee Nation HR policies and guidelines?
They have their own HR policies.
Are their policies are they a direct reflection or correlate? Are they similar to Cherokee Nation, or are they different?
Their discipline policy for this reason is, I don't know about the rest of them. I don't know what their timekeeping policy is, or some of those others. I don't think they're the exact same as ours. I think they have their own complete set. I'm sure it's a book this thick, like ours is.
So this PACE is a sister or a brother under the Cherokee Nation Health. And so they're,
I call it like a step kid.
Dr. Smith, you're calling.
Counselor Buzzard, you might want to mute your speaker.
I think he's want to talk.
so the elder care,
Thank you.
these are brother and sister affiliates under the Cherokee Nation healthcare system. And so they're not,
They are not under health. They are statutorily created agencies that sit out here with the board, that the statute says this is how this agency is being created to offer this elder care program. We're going to appoint 5 board members, and they are the decision-making authority for them. So they're not under health. Just like all of our other, I mean, we have, again, we're thinking about tax commission, gaming commission, environmental commission. Those don't fall under anyone. They are agencies, for lack of a better term. They don't report to an individual within administration.
well, so, I don't know, I'm trying to, I understand the HR part of it being under the PACE program. And then we got our Cherokee Nation HR policies and guidelines. So if somebody was to resign or leave, and say they want to go to the tax commission or the election commission because they're autonomous or independent, would those employees still fall under our HR guidelines?
Those are. The boards are not under us, but the tax commission, gaming commission employees are regular full-time Cherokee Nation employees.
Okay.
But their board does not, they don't fall under any department or individual.
Okay, interesting. All right, thank you, Chris. Thank you, Chair.
Thank you. Any other counselors with questions? Because I have several. Okay. Thank you, Chrissy. Appreciate it. Dr. Jones, I have a couple of questions. On Muskogee, this last month, I noticed that their refills were substantially higher than Hastings, who had twice the patient visits. Would it be possible that you could break it down to tell us what the diagnoses, top maybe 5 diagnoses were in the future of these clinics? So it might give us a better idea and understanding of what is going on. I mean, Hastings refill, I'm talking about refills. I had approximately almost 13,000 refills, and yet Muskogee had approximately 18,000 or more. And yet Hastings saw twice the visits. I'd just be curious to see the differences in diagnoses, to see what the difference is.
Sure, we can do that.
And then I'd like to talk to you about, I had a patient contact me, very distraught actually, about the, and by the way, Mr. Hale, Brian Hale, was very helpful with me on this one. They got off work, they were sick, and they didn't get off work till 8 o'clock, so they went to the emergency room who referred them to urgent care, where they sat for 4 hours without any hours being posted that urgent care was going to close.
Okay.
And then they were dumbfounded. No one even alerted them that this was a possibility. And they were diabetic, hadn't taken, they needed to eat and get some blood sugars checked, and this wasn't happening. And I do believe they were offered the chance to go to the emergency room after the lights were about to be shut down on them. But we need better communication with our patients in situations like that. Perhaps this person, had they had any idea that they were going to wait, perhaps they could have had time to go get a cracker or something to eat.
Okay.
And I think if we could post information, it would be more helpful to our patients.
Did
And I
Mr.
would-
Hale did he get with you and help you get work through, or did he get back
Yes,
with the patient?
actually, Mr. Hill was very helpful on this at rescheduling their visit for them because they weren't able to be seen that right then. I mean, their situation indicated they had to leave and get home to have something to eat. Okay. The other thing I wanted to talk about was our physicians. Are we going to have enough? How are we going to do the, when we open the new clinic, tell me how we're going to be staffing this clinic. Can you tell me what the plan is right now?
Some of the plan is to move some of the services from Hastings over into the outpatient. The outpatient services will be moving over, so we have existing staff there. And then we've identified how many of those additional staff we're going to need as we ramp up. Because we won't just open the doors and be fully operational at maximum capacity day one. The facility is built on a graduated weight over years of growth. Okay, so we will be ramping those up. We've identified positions now that we need in order to open, and we've started advertising for those positions. As a matter of fact, before I came over, we signed off on several job announcements that will be coming out shortly. So we've identified this many months out, we need to do these positions. This many months out, we need to do these positions. And we're starting to ramp that up now. But we have to have a place to put those people, and we don't have, facilities are pretty cram-packed right now, so we can't hire a whole lot of people and not have a place to put them to work. So we're starting to recruit, and those that'll take a little longer, we're starting a little further out to start ramping up and go through the recruiting process.
Will we be staffed similar to where, will we be staffed something like where we'll have hospitalists at the hospital and then our other physicians just at the clinic? Or are they going to be cross-referencing?
They'll be working in both places because Hastings will remain an inpatient facility, and then we'll have our outpatient services in the new facility. So that's the differentiation of that. And yes, we will have, for example, pediatrics. We'll still have pediatrics physicians that will be going over to the hospital. So we'll still have it just like you would in any other system where you have a hospital associated with outpatient services.
Very good. Can you tell me, I know, how are we recruiting physicians and staff? Do we have a professional search firm? Are we doing it independently?
We have a recruitment department here that has their own budget on how they go out and recruit, and several different agencies that help us along with recruiting as we go. Like I said, as we've identified those positions that we're needing, then we're starting to filter that in and so that they can start looking for those positions. Our prime time comes around March, April, May, that time frame when people are looking for where they're going to go when they graduate or when they're finishing residencies. And obviously we're looking at those, our own residency that we're affiliated with through the OSU department and things like that. So we're recruiting, we're on top of it.
And I appreciate your help in referring that one request for information or wanting to help. I appreciate that immensely. Thank you. Yes, Councilor Crittenden.
Yeah, real quick, Doctor, some of those employees that you're kind of holding off on hiring, are some of those doctors or physicians?
Typically, no. We're looking at, right now we're looking at recruiting for those positions because typically they're not coming out of either their education or their residencies until closer to the summertime. So we're already in the process of talking with those folks and trying to decide what fits us and who wants to come to this area, things like that.
So we're not holding off on hiring doctors?
No.
I mean, for space sake? All right.
No. So if we have a need currently, we're looking at trying to fill that need even though we haven't moved over there yet. So, because we do have a lot of outpatient services that are going on in the hospital now that will be moving. So if we have that vacancy now, we're obviously recruiting for it. It's just, you don't go out and find, this is, a little bit of the misnomer. Most people are under contracts right now. They're under residencies. They're in their educational requirements, and they don't just leave those and come to you tomorrow. Those are processes that take a while for them to get out from under their own contract, or maybe their contract's coming to an end, and we have to anticipate when that's going to happen. So it's not something where they're just available every month of the year. There are certain times that they're more available than they are the rest of the time. So if we miss those windows, sometimes it takes a lot longer to fill that position because you got to wait on the next class to come out or the next residency to end, or things like that. So.
Thank you.
Thank you. Yes, Councilor Walkenstick.
The individual you guys, or the PACE has in mind for this position, they have it's Davis Medicare Medical Supplier Services, and they're a tarot vendor right now in Cherokee Nation, and we need to make sure that they're not doing any business with Cherokee Nation.
I'm not aware of who they've selected or anybody they've selected. I'm not privy to any of that information, so I couldn't tell you who has even been
make sure that that there's not a conflict. 'Cause I know we have an ethics policy in place in Cherokee Nation where if you're an employee of Cherokee Nation, that you can't be doing business with the Cherokee Nation. And so I guess my question is if they're if this person does get into this PACE position, and they're not under Cherokee Nation, are they eligible to do business with Cherokee Nation?
No, that would still apply because that's a constitutional provision that employees cannot have an ownership interest in a business doing business with Cherokee Nation.
But they're not under Cherokee Nation,
But
their PACE
for
is separate.
constitutional purposes, because of this case, they are. So anyone who works for PACE, Home Health, Hospice, any of those organizations, if they're employees for the purpose of constitutional protection, they're also employees for the purpose of conflicts. And you cannot, if you are an employee of Cherokee Nation, you cannot have an ownership interest in a business doing business with Cherokee Nation. And we will, if, we can look into that.
Okay, all right, thank you.
Something we look at all the time.
Okay, thank you, Chris. Thank you, Chair.
Thank you. Any other questions here? Oh, okay, Secretary Byrd.
Dr. Jones, I ran into a physician that we're going to hire, and I know we're out there trying to recruit, but I read an article, and I was around some IHS people at NCAI. In the north, through IHS, they hired some physicians without doing their due diligence. And it was a tragedy on the services that they received and some of the records. They didn't do their due diligence, criminal. But they were there 20 years. They just shift them from one agency to another. And I know with the shortage of physicians that we have here in Cherokee country, it warrants us to really get aggressive in recruiting. But I also want to make sure that we do our due diligence and bring in the appropriate people, or it'll be, I'd rather be safe than sorry on this one here. You may know some of the incidents I'm talking about in North and South Dakota.
Absolutely, and we do extensive background checks. We like to look at our the residents that are spending time with us because we get a history of working with those folks. So that's been a big recruiting tool for us. So yes, I mean we would rather find the right person than just a warm body.
Yes. Well, I think we have turned the curve. We'll get the right positions here once we get our facilities going and do our education, our schooling. I still, I'm trying to be optimistic about our new system here where we're going to train our own doctors. I'll believe it when it works, but I want to be optimistic about it.
Yeah.
So thank you, Dr. Jones.
Dr. Jones, am I correct? The new 469,000 square foot facility is going to have 182 exam rooms. Is that correct?
I don't know those numbers right off the top of my head, but
Sounds about right.
There's a lot of exam
Close.
rooms. Yeah, if you walk down through there, you'll see a lot of rooms.
Well,
But
I'm excited
the
about
other
it.
thing on that is to think, we're in a model right now where we have limited space.
Right.
And so when you give a physician more space and more support around him, there's going to be more rooms he can manage and therefore increase access. So we're going to work on, increasing efficiency and access.
Yeah. Thank you for that. Let's see if we have any other questions here. Any other old business?
Question.
Yes, I'm sorry, Counselor Austin.
Do we have an update on moving the contract health in Claremore to the new office?
I don't, but I do have Steve Carey with me today, so he may be able to answer that.
Along on that, we were, with the demolition of the other building, our IT folks were all pulled to the transition. We're doing podiatry, ortho and stuff with Hastings right now. They were all detailed in that area last week. I believe they're about finished up, but we were the very next project. So my anticipation is they'll be up to this week.
Okay. Just didn't want it to end up being another orthopedic.
We just kind of got put to the back burner a little bit, but we're still on. We're on River Day.
Thank you.
Okay. Okay. Any other questions here of Dr. Jones? Okay. Any old business? New business. Dr. Dobbins. Dr. Jones, would you please stay just for a few minutes?
Yeah, it's listed on new business discussion only, naming the new clinic at W.W. Hastings Hospital. I suppose this was set as an agenda item about 10 days ago, and there's been some new information come to light since then. And Dr. Jones alluded to it earlier. I might pass along the Building and Facility Naming Act around, because it is the council's charge to name buildings within the Cherokee Nation. Pass that. Dr. Jones alluded to it earlier that for the time being, it appears as though the best course is going to be in fact, it's named in the naming act that you're going to get, to have a temporary generic name, which is to be can be in existence for up to 1 year. And that temporary generic name, again, Dr. Jones, was what? That they,
Cherokee Nation Outpatient Health Center of Tahlequah.
so that's going to be at least and for the purposes, Dr. Jones, could you tell the council why we need to have this temporary generic name in place?
As I said before, just to get through the certification and licensing agreements that we have to get through in order to be able to bill, in order to be able to get our radiology equipment certified and licensed, get our providers licensed and third-party contracts in place, Medicare, Medicaid, all those things have to be done. And some of those require site visits, so we've got to get the application process started so those people can come out and do the things they need to do in order to be ready to go when we're ready to go.
Okay, Counselor Shambaugh.
I'll be quick. You answered the two questions that I came here wanting to answer right off the bat anyway, about this naming, why it has to be done, or why it needs to be done today, and if it's done, can it be changed at a later date? And obviously it can. I would assume that I would speak for everybody when I said that this probably isn't the name this hospital is going to get. Later on, there's going to probably be a different name for this hospital, but and I think later on, we need to look at other parts of the hospital, just not the name of the hospital. We need to look at other parts of the hospital that need to be named too, different things. But today, I trusted Dr. Grimm and his judgment. I'm going to trust in your judgment whenever you tell us this needs to be done today. And it may be a generic name, but it's being done for the right reason, and the right reason is for the betterment of the Cherokee people. I mean, if that's the best way that we can serve them on this council, of doing this today by getting this name where you can talk to the vendors and get different things accomplished that you need to get done on time, I wholeheartedly support that. And for that reason, I'm not so much worried about the naming of it today, but I am more so worried about making sure that you are given the opportunity to do your job to your best ability. And I think by doing this today, I think that does give you and your troops the best opportunity to get this hospital done on time and get the vendors that we need and other things like that. So for that reason, I'll be supporting you today.
Thank you.
Counselor Crittenden.
No, this is just discussion only, right?
Yes.
We're not taking any action.
Yes, it was presented as a discussion item by Counselor Dobbs.
So-
Excuse me.
So are we taking action?
No, it's
Discussion
just
only.
discussion
Well,
only.
if I could add one thing, it's my understanding that we probably don't, does this need to get counsel? It doesn't to be named. It's my understanding it doesn't have to. This, is that correct?
Not for a generic name.
Right.
So a generic name, it can, that can be in place up to a year.
So
But
in
no
the-
more than a year.
In the light of that, when I say I support that, I do support that. That, if that's what you want done and you don't have to have our approval to do it, I support you doing that. I should have been more clear.
Thank you.
Okay, yes, Counselor Crittenden.
Yeah, I was just gonna say yes, the licensing, if it was something that we needed to do to get this rolling. But since it's just a discussion only, my old hard head keeps going back to last month, when Councilor Walkenstick laid something as minute and pesky as our election process, who really, that process appoints the people who's gonna take care of our Cherokee people's services. So, I didn't get to say all I wanted to about that. I'm not gonna do it right here. Some people feel the way I do. I've had a heck of a time on different things discussing. Sometimes I feel like I'm getting rushed or in a hurry. Want to discuss the UKB brothers and sisters. Just, didn't even make it to the agenda. The national treasures, wanting to get their voice heard. I had one heck of a time. Just different issues, wanting to discuss it. I've had a hard time, and last month sticks out in my head. So just for the hard-headedness of it, I'm gonna just see where it falls. I'll make a motion to table this indefinitely. This discussion.
Okay, is there a second on this motion? Motion fails, no
There
second.
you go.
Okay. Secretary Byrd. Speaker Byrd, excuse me.
Yes, I talked to some IHS people there while I was in DC, and the naming of this is, yeah, it's not an urgent thing, but there's some certifications I think we need to address. And I think we're going about it the right way. It is the responsibility of the council. And I feel like we need to poll or get with constituents. I've talked to some people already, you know, from naming it various things, but I would like to impose, when that time comes, a Cherokee name in there. You know, that's what we are. We are the Cherokee Nation. So it's good to give it that name, but you know, just always, I'm always going to be doing this. When we give it a name, when we do something here at the Cherokee Nation, let's make sure we always implement the culture part of the tribe. If we do that, then we'll always stay Cherokee Nation and not be a corporation, which I'll fight till the very end. But I appreciate this, Dr. Jones. I mean, this is a good concept.
Under the authority to do a generic name that was as generic as we could come up with, that kind of comes up with what the facility is, so that we can get these applications in place and move forward with them. Because like I
You
said,
could put some Cherokee in there somewhere.
sometimes they have one stacked on the other, so you can't even start the next application process till you have this one finished. So we're getting into a very time crunch situation.
Okay. Thank you,
Counselor
Madam Chair.
Dobbins, thank you for this.
Too,
Yes, sir. Yes, sir.
as stated in the act, the temporary generic name, it just says where the executive branch, for ease of reference, designates Cherokee Nation building, so we don't vote on it. It's not come from the executive office. It just says for ease of reference for this temporary generic name.
I'm sorry, Counselor Dobbins, would you reiterate that one more time? I don't think I heard that.
On the naming act that I passed around, it'd be Section B, item number 1, under temporary generic names. It explains that where the executive branch, for ease of reference, designates a particular Cherokee Nation building or facility by name of the community in which it is located and the basic function that it serves for a period not to exceed 1 year. So this is not something that council votes on, this temporary generic name.
Wonderful. Thank you for your work on this. We appreciate it. I think it's also going to be our responsibility to name the streets, if I am correct, that we will also be naming streets around the facility. And Counselor Stick, we got 30 seconds here.
Thank you. So, you know, this is, I like what Speaker Byrd mentioned, that, you know, we've, you know, us just trying to define our identity as a tribe, not a corporation or institute. We do need to have some type of Cherokee relevance or cultural relevance to identify who we are as an Indian people. And it's some of the names that were being brought to us was discouraging, and it was a little self-righteous. And we're not in the business for that. We're all in this together. We're in here to try to identify and get our culture back. And you know, I know we're spending millions of dollars for art and everything inside the hospital to identify this hospital as being a tribal hospital, a Cherokee hospital. But I was saying that I think we need to visit with elders in our different communities to figure out what is a good name for that hospital. Because a lot of our folks that's in administration didn't grow up cultural. Some of them didn't grow up Cherokee. So they really don't have a good idea on how to name a hospital. And, you know, like, you know, Speaker Byrd, he had Dennis Six Killer and some other elders in his office polling them, said, what would be a good name for this? But those are the people that we need to be listening to, not the executive branch and not the executive level. We need to listen to the elders.
It sounds like this is the group that will make that decision. I don't even know what names
Counselor,
have been
yes.
suggested, so
Thank you for
out of
those
that
comments.
loop.
Counselor Hatfield.
You are born Cherokee.
Yes.
You're born Cherokee. The day you're Cherokee. It's not about how you're brought up. If you lived in that culture, you are Cherokee or not. That's it.
May I ask personally, how many in this room were born at Hastings? Born at Hastings? See those numbers? Proud of where we've been from and where we're going. Listen, our next meeting is scheduled for March the 11th, 1 p.m. Can I get a motion to dismiss? Second. All those in favor? Thank you.